You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to PM&RRecap.com to learn more.
Any luck with the audio right now, folks?
We can hear you now.
Yep, that should be good.
Hi. Well, I'm going to slide back over here then. I'm Dr. Joseph Burris, and I'm the PM&R Residency Program Director here at University of Missouri. And we're going to have a little panel discussion here tonight with some of our residents. And I'm going to turn it over to them real quick since we had some audio troubles, and they're going to tell you about our program. Thanks.
Great. Thank you, Dr. Burris. Thank you, PM&R Scholars, for hosting this event tonight. We're excited to tell you a little bit more about our program here. My name's Jess Rowland. I'm a PGY3. I have a co-resident here with me as well.
Hi there, I'm Hannah Farmer, also PGY3.
And I'm Ben Gill, also a PGY3. I'll be answering any of your questions on the chat.
All right. All right. So, Dr. Burris, just with his introduction, he's our program chair here, program director. Dr. Finkel, Claire Finkel, she is the associate residency program director, and just want to kind of introduce you to the rest of our leadership team. Certainly have a robust set of faculty members here, in addition to our 12 residents. So we composed of 12 residents. We have 4 residents within each class. Here tonight we have the majority of our PGY3s to tell you a little bit more about our program. So we're going to get into that here. And of course, just remember, if you have questions during this presentation, feel free to send us a chat, and Dr. Ben Gill will be happy to assist any questions there. So, given our faculty and residents, we certainly have a fair ratio. Never an issue with having faculty at our disposal for assistance, either whether it's clinically on the floor or kind of outside of clinical work time. Certainly available either in person, via email, phone, text. That's a nice resource to have.
And just to go over some of our training sites, we do have 5 main sites. Rest Rehab in the center there, that's our freestanding inpatient rehab hospital. That's where you'll spend most of your PGY2 year. It's a 58-bed University Hospital, Missouri Orthopedic Institute, and the VA are all within the same campus with easy parking. It's easy to walk there. And women's and children's is where you'll do most of your pediatric rotations. The nice thing is nothing is more than a 10-15 minute drive away. It's very drivable, easy to get around.
And so just want to discuss briefly the rotation schedule. Here at MIZZOU, you're going to accomplish what you need to accomplish in order to graduate. So this information is available on our website, so I don't want to spend a lot of time on this. However, I will say that as a PGY2 coming in, you're predominantly going to be spending time at our freestanding rehab hospital. That's Rusk Rehab Hospital that Hannah was just mentioning. And so the vast majority of your PGY2 year is going to be inpatient rehab rotations. Here at MIZZOU, we have 4 inpatient teams. Those are stroke, amputee, brain injury, spinal cord, and then kind of typically if we have pediatric patients, that is for the resident who's on the pediatric service. We'll be covering those patients. So do just want to mention, currently my experience as a PGY3, I'm on rotation at the VA. So, as a PGY2, Dr. Farmer and I were at Rusk last year quite a bit. And we've kind of transitioned now to predominantly more outpatient rotations, a blend of different training locations that, like Dr. Farmer said, are kind of all within the same campus. So it's really easy to kind of get around to these different areas. Currently, I'm in the VA right now learning about EMG.
I'm also at the VA. I'm on VA1, so we're doing general PM&R. We also have bracing and amputee clinic.
So, the remaining of our rotations typically outpatient, kind of with the exception of pediatrics. They're covering inpatient when applicable. And then as a PGY4, we do have the opportunity for 3 months of electives that does occur, which can kind of be tailored to individual needs. So whether that's fellowship, auditions, research, or a specific area of interest that a resident does have.
And just to show you our procedures, we don't have any trouble meeting our requirements. Residents get a lot of exposure to procedures. Jess was actually just on a procedure heavy month.
That's right. Yeah. So I May and then July was working at the VA doing interventional pain, logged over 100 procedures, doing axial spine interventions there. So certainly not an issue.
So call, we do home call. Call is split up between weekday and weekend call. So you'll do, as a PGY2, you'll do 7 Monday through Thursday and 7 Friday through Sunday. And then that decreases from there each year. You have the weekends off unless you're rounding. And then as a PGY3 and 4, you do not take call for holidays. Pretty good schedule.
Yeah, absolutely. So currently this week I'm on call during the week. So certainly, available to respond if there's any need for physician assistance on the floor at Rusk. But again, that's call from home. So I'm able to kind of take care of either personal or professional needs while responding to those calls. And then here's just a slide of our salaries. So ultimately, I would say that Columbia, Missouri, the cost of living, the salary that we receive for the cost of living is very competitive. Been able to have no issues with anything in that regard. So for me, it was kind of exciting. Columbia, Missouri kind of afforded me the luxury of being able to purchase my first home, which I'm not sure other locations I would have necessarily had that opportunity. But it's definitely a perk for me.
So just to mention some of our benefits, I think some ones that are more notable than others. You do have meals that are provided to you while inpatient at Rusk, as well as in the physician's lounge at the university in women's and children's. You do have PM&R and AAP memberships covered, and you have a educational stipend each year. And you will get, you can get expense coverage for conferences for poster presentations. So I know a lot of us this year may have that opportunity with our research for PM&R, see how AAP goes.
Yeah, so those things coming up certainly. I know today I just emailed our program coordinator asking her to get Preston and Shapiro and EMG book because it's kind of what I'm diving into now. So certainly not an issue getting having these resources available at our dispense. So and then mentioning PM&R, AAP. Research here at MIZZOU, it's certainly something that is available and robust. I think that we have plenty of opportunities for engaging in research. If that's something that you're new to, there's mentorship via faculty and co-residents who kind of come from different backgrounds. So that's been, I think, a nice thing about this program is kind of having just different minds within our program to kind of help shape each other really.
Yes.
Yeah, so not necessarily a formal requirement, but you know that's something that we do kind of encourage each other and kind of have fun with along the way. So here we have just kind of a quantitative view of the number of presentations that we've had at national meetings, kind of most recently and then in the distant past year. So certainly research is occurring here at MIZZOU.
So our didactic schedule, we do have 3 hours a week. Didactics are on Tuesdays and Friday mornings at Rusk location. We do have an ultrasound curriculum that's every 2 weeks over the lunch hour that we'll meet together and do ultrasound with some of our MSK doctors. We have journal club that occurs every once a month in the evening. It's been via Zoom for the past year, but that's been really helpful to go over articles. And then you do have mock oral boards quarterly, which I think is great. We get to go over how we would prepare for boards beginning as a PGY2, so that's been really helpful.
Yeah, kind of you know, one of the things that we're very proud of here is the prosthetic and orthotic conference that we have in the spring every year. So, you know, we were able to kind of be a part of that as PGY2, where we invite kind of surrounding Midwestern programs to take part in that as well. You know, I think with regard to didactics, it kind of feels like there's always something going on, right?
Yeah.
But I think at the same time, it's it hits things from different facets, or it's very like multidimensional, and certainly very manageable. So just some pictures here of our residents, both kind of within work, but here bottom left we have a picture at a national conference, and you know, then just top right we have residents just kind of learning about different mobility devices. Anything else?
Yeah, practicing EMGs and nerve conduction studies.
Yeah. So here with our leadership, again, there's plenty of opportunity to be involved in leadership, both at a kind of a local, regional level, but then also national level. Currently, we have individual residents who are representing us on the national level with a PM&R. Dr. Ben Gill is part of that, and it's PGY4, Dr. Taylor Kalan, who most recently. But then within Rusk itself, or with here at MIZZOU, we do have multiple committees that you know require just kind of oversight, and so we have the opportunity to be involved with them as well.
We have about 5 minutes left.
Great, thank you. So regarding fellowship, just kind of a shout out to our PGY4, Dr. Kevin Moylan, who recently mastered the interventional spine medicine fellowship at Cleveland Clinic. And here we just kind of have a list of our recent graduates who mastered the fellowships. And so, you know, I think if that's an interest of yours while you're here, I certainly have received nothing but support from faculty, co-residents regarding, you know, pursuing those career goals. And then some extra educational opportunities. Did just want to mention, you know, in addition to kind of our robust didactic curriculum, there are additional activities that, you know, if you do have an interest, especially I would say in like musculoskeletal or sports medicine, that are present and great to be a part of. So MIZZOU, that's our free musculoskeletal clinic associated with the University of Missouri. I was actually just there last night. And so that's like a medical student run musculoskeletal clinic that we as residents have the opportunity to take a part in and provide mentorship and assist with patient care for kind of underserved patients. Additionally, Friday Night Lights is kind of a comprehensive training that's coming up here later this month that provides residents with clinical skills to go and do coverage for local high schools, sporting events. And then I do want to mention MIZZOU wheelchair basketball, which, unfortunately due to COVID has kind of been non-existent this past year. However, I do remember as a student just getting the opportunity to go to a MIZZOU wheelchair basketball game and just kind of be sideline medical assistance there with a current resident at the time.
So about Columbia, Columbia is located right in the middle between St. Louis and Kansas City. It's easy drive to either of those locations. It's about 110,000. It's a good college town, lots of opportunities to watch sporting events, go to festivals. There's a big True Falls Film Festival in the late winter every year. Lots of opportunities for restaurants. There's a local airport that flies to 3 big hubs, free parking at the airport, and yeah, very drivable, no traffic here.
Yeah. Certainly, nice place to live, like we mentioned with the salary, just cost of living is easy. I will say just pretty big into the outdoors personally. So Columbia has multiple things to offer, especially biking. It's very large in our community here. But kind of just outside of Columbia in the general vicinity of the state, I mean, there's like multiple areas that I've marked on my Google Maps that are a 2-3 hour drive that I'm interested in checking out. And so with most weekends off and holidays off, it makes it easy to kind of pursue those sorts of things outside of work, which I think is beneficial. So I think that kind of sums up,
Great trails in Columbia. I was just walking on the trail before I came here. Easy access. Yeah, see deer all the time.
Again, some more photos of our residents enjoying the things that Columbia has to offer. So here at MIZZOU, like I said, rehab like a champion. So, hope that you're able to do that wherever you end up landing. If you have any questions, feel free to message us and we're here to answer them.
I think that's all the time we have for today. I really want to thank the University of Missouri for taking time to participate and present today. In case you guys have any further questions for them, feel free to drop it in the chat. But for the sake of time and for everyone else tonight, we're going to go ahead for the next program. It's going to be the University